So thank you everyone for coming tonight. We'll get started here and I'll start my timer. So I'm trying to be more accurate on the 20-minute break time. So tonight's session we'll be talking about stress, trauma, stress, and the vagus nerve. And sorry for the bright daylight here. We're not getting a very good screen, but you can read that, eh?
Never get to
Oh,
see
yeah, no,
that
it's pretty
too many
good.
times a year.
I'm just going to put this way. Okay. But first we have a few housekeeping slides that we go through. First we do our bit of introductions here. For those who are new here, my name is Deb Angus. I'm the founder of this group. And I'm also a traumatic brain injury survivor warrior, coming up to 18 years now. And I was diagnosed as mild, borderline moderate as a result of multiple concussions throughout my lifetime, 3 of them which I didn't even know about. And I'm also the author of this book here. I wrote and researched over a 10-year period while I was recovering and also managing to hold down a full-time job. And it is available at the Calgary Public Library, and it is available here as well too. You can buy direct from me. And I used to work at the University of Calgary for 30 years, and my last 2 positions over the last 19 years, I was a research assistant. And my co-founder and cohort is Josie. She's a concussion survivor warrior. 3 years now, I believe, she is into her journey. And she's a former healthcare nurse, and she advises me in the background as well too. Welcome. So why are we here? To help raise awareness about the seriousness of concussions and traumatic brain injuries, to help you understand the symptoms of a concussion, how easily these injuries happen, the healing process for concussions, and consequences of multiple concussions. And please do let me know if I'm talking too quickly. They always tell me that. To share coping strategies that will help you while recovering from a concussion and to live well in spite of a brain injury, and to provide support for those who are afflicted with these injuries, and to help family and friends better understand what you are truly up against. And we have a medical disclaimer. The ideas, suggestions, and general principles and conclusions presented are subject to your personal health and sound medical advice. Every possibility is not represented here, nor do we presume that all possibilities relate to your specific situation. This awareness group is not a substitute for recognized medical advice or treatment. Always consult your healthcare practitioner or practitioners for medical advice. And we have group guidelines here. Confidentiality, thoughts, feelings, experiences shared in this group will stay in this group. Respect others' right to keep their information private. Accept and respect what is unique to each attendee in the group. Be respectful of others' spirituality, religion, and belief systems. Allow others equal time for sharing. Participation. Feel free to ask questions at any time during the presentation. And if you prefer to remain silent and pass on sharing once we get to our sharing circle after the presentation, please feel free to do so. And our meeting structure, generally we try and stick to this. That's why I'm doing my timer tonight. We start out with a 20-minute presentation. And then if anybody is high symptomatic here, I will give them an opportunity to say, do you need a break? And we will allow a 10-minute break. And then we continue on with our presentation, or sometimes we do bring in a guest speaker. And then we follow up with a 30-minute sharing circle at the end. And that would be an excellent time for everybody to shut off their cell phones. And we'll begin here. Dr. James Haxton, he was here last month. He was our guest speaker, and he came to talk to us about chiropractic functional neurology last February 22nd. And he touched a bit here on the vagus nerve. And here he says 3 hours after a head injury, changes in vagus nerve firing alter the lining of the intestines, and the heart rate control can soon follow. So this touched on the vagus nerve, and this brings us to why I'm doing the presentation today. Trauma, stress, and the vagus nerve. And this is our presentation roadmap for the evening. We'll be covering getting to know your vagus nerve dysfunction, how the vagus nerve is damaged or irritated, how the vagus nerve is affected by head trauma, vagus nerve testing, vagus nerve stimulation, the gut-brain connection, and healing trauma. So we'll start out here, getting to know your vagus nerve. It is actually the 10th of the 12 cranial nerves in our body. It is the longest nerve. that links the brainstem with the neck, the heart, the lungs, and the abdomen. It also branches out to the ears and tongue, liver, kidneys, spleen, gallbladder, ureter, and reproductive organs. So here's a diagram here. It shows all 12 cranial nerves. And here we're talking about the vagus nerve. And you can see how it is connected to the brainstem there. And then this is how it branches out. It actually has two main arteries that come down and branches out. And they're connected here to the eyes and all the glands in the neck area here, as well as the heart, the lungs, the stomach, the aorta, which is part of the heart, the liver and gallbladder, the pancreas, the adrenals, small intestine, large intestine, the kidneys and the bladder, and the reproductive organs. So it's just amazing how this connects to practically every system in our body. It controls involuntary bodily function. It keeps your heart rate constant. It aids in food digestion, breathing, sweating, regulates blood pressure and blood glucose balance, promotes general kidney function, helps release bile and testosterone, plays a major role in fertility issues in women, stimulates the secretion of saliva, and it assists in controlling taste and releasing tears. The management and processing of emotions works directly with the vagus nerve between the gut, the heart, and the brain. And that's why we have a strong gut reaction to intense mental and emotional states. It's like when you say, oh, I had a gut feeling about that. That's why it's this vagus nerve is kicking in. And medically they call that the gut-brain axis, but commonly the general public refers to that as the gut-brain connection. Who here has heard of that? Yeah, pretty well everybody? Like a communication superhighway of connectivity between your gut and the brain. The gastrointestinal tract is constantly confronted with food, antigens, possible pathogens, and symbiotic intestinal microbiota that present a risk factor for intestinal inflammation. And this is referred to medically as the neuroendocrine immune axis. The vagus nerve is the most important nerve you probably didn't know you had. The vagus nerve represents an important link between nutrition and psychiatric, neurological, and inflammatory diseases. It is critical to your overall health as it is intimately tied in with multiple organs and systems of the body. Vagus nerve dysfunction. There are two types of dysfunction that can happen. One is when your vagus nerve is overactive, and the other is when your vagus nerve is underactive or inactive. And this is just a very basic overview. I'm not going to get into a lot of medical terminology, but just basics for you to recognize the significance of this nerve and how it does connect to everything and how it can affect so much stuff. So overactive vagus nerve. Let's pretend this little guy is an overactive vagus nerve here. He's just going to town. Sometimes the vagus nerve overreacts to certain stress levels. We've had enough of you, mister. Exposure to extreme heat, fear of bodily harm, the sight of blood or having blood drawn, straining, including trying to have a bowel movement, and standing for a long time. So when your vagus nerve is overactive, it stimulates certain muscles in the heart that can help slow heart rate. When it overreacts, it can cause a sudden drop in heart rate and blood pressure, resulting in dizziness or fainting. Most of the time you can just sit down or lay down for a while and the symptoms will subside. If this continues to be a problem, then it would be wise to seek medical advice. Was there anybody here who's experienced a lot of fainting at all in their lifetime? Not at all? Oh, you? Did this happen before or after your concussion?
After.
After? Wow. Okay. And did you know it was connected to the vagus nerve? Oh, good. Okay. And then the underactive vagus nerve, low vagal tone is associated with psychiatric or mood disorders, poor emotional and attentional regulation, depression, anxiety, feeling unsafe. Depersonalization means feeling disconnected or detached from one's body and thoughts, feeling like you are observing yourself from outside your body, or like being in a dream. So who here has had a concussion, has experienced any of these? Pretty well, yeah. This is why I have to stress this, and so important that we are aware of what a concussion is and the symptoms are, and as well that the practitioners that you're going to be visiting, that they're also aware, because if they start zooming in on the psychiatric issues, they're going to start medicating you. I've heard so many people saying, well, I was diagnosed with depression and anxiety, and they give them medication. Well, they have depression and anxiety because they have a concussion or a brain injury. Here are other dysfunctional symptoms from the vagus nerve when it's underactive. There's fatigue, brain fog, food sensitivities, vitamin B12 deficiency, constipation, obesity, swallowing difficulties, speech issues, and voice fatigue, like when you lose your voice, impaired cough, and clearing of the throat. It also shows up as bradycardia, which is abnormally slow heartbeat, and also chronic inflammation and immune issues. This is the important part right here. Well, it's all important, but this one here specifically. Systemic inflammation is an underlying cause of chronic disease, from cardiovascular disease to autoimmunity, cancer, diabetes, and more. Inflammation creates immune dysregulation and precedes a slew of other problems, such as epilepsy, lupus, rheumatoid arthritis, celiac disease, and chronic fatigue syndrome. It also, in gastrointestinal diseases, microbiome imbalance, leaky gut, gastric ulcers, IBS, irritable bowel syndrome, and gastroparesis. It's a condition where your stomach cannot empty itself of food in a normal fashion, and it can lead to severe complications like diabetes. So how can the vagus nerve be damaged or irritated? It can be accidentally severed during surgery, especially if you had any abdominal surgery. But as the vagus nerve covers so much territory, I would say if you had any surgery on your neck, on your heart, or anywhere in your abdomen especially, you're going to have, that is always a possibility. Botox has been known to shut down the vagus nerve. Mercury blocks acetylcholine production, which is a neurotransmitter, and here's a bit of history on that. In 1921, a German physiologist discovered that stimulating the vagus nerve caused the heart rate to slow down by triggering the release of a substance he called Vagusstoff, which is vagus substance. It was later discovered that this substance was actually acetylcholine, a naturally occurring neurotransmitter in our nervous system, and that was actually the very first neurotransmitter ever identified by scientists. And so when acetylcholine is blocked, it interferes with the heart muscle receptors, and the heart cannot receive the vagus nerve electrical impulse for contraction, and then cardiovascular disease follows. Certain medications can also interfere with acetylcholine production, so if you're worried about that or concerned, you check with your doctor on that. Upper respiratory viral infections can also damage or irritate the vagus nerve, as well as fatigue and anxiety, even bad posture. A cafeteria diet, high fat, high carb junk food, reduces the sensitivity of the vagus nerve. Spicy foods can cause the vagus nerve to misfire, and diabetes can damage the vagus nerve if blood glucose levels remain high over a long period of time. Now this I found fascinating, because if you have a vagus nerve that is not operating properly, it can cause diabetes, because your stomach isn't emptying properly. But if you have diabetes, it can also damage the vagus nerve. So yeah. Chronic stress can inflame the vagus nerve, such as physical, emotional, or psychological stress. And that initiates a fight or flight response in our body. And then you go into overdrive, a hyperactive state, which creates an increased risk of disease because it causes inflammation. And such instances as domestic abuse, high crime lifestyle, drug and alcohol addiction, untreated PTSD, and undiagnosed concussions or brain injuries, because you're in that hyper mode all the time and you don't know what's wrong and you don't know how to make yourself better. So how can the vagus nerve be affected by head trauma? The cranial nerves are vulnerable during head and neck trauma as they originate in or near the brainstem. And again, here are the 12 cranial nerves. The first two, olfactory and the optic, they're the only two of the cranial nerves that are not directly connected to the brainstem, but all the other ones are. Many of them run over the surface of the skull and are only protected by the muscles and tissues of the face. Penetrating, scraping, and shearing injuries can stretch, rupture, or cut across a cranial nerve. Broken facial and skull bones can also damage the nerves. The effects of cranial nerve injury may be temporary or permanent depending on the nature of the injury. If a cranial nerve is completely cut in two, it cannot be repaired. That's just the way it is. If it is stretched or bruised but the nerve remains intact, it can recover. But this takes time, like many, 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 many years, and can cause a variety of unpleasant symptoms, including tingling and pain. These symptoms are a good sign that the nerve is healing, but it is very unpleasant and sometimes it causes a lot of pain. I've had it twice throughout my lifetime and the doctors have never given me anything for it. Some of them are. I've heard other people are getting medicated for this, but the side effects cause dizziness and falling and stuff like that. And we're already dealing with that, so it's kind of adding more risk to it. And so how I dealt with that was soaks in the tub with Epsom salts and essential oils, homeopathic medications, even putting a hot cloth on where it hurts. I had trigeminal neuralgia here. It was just like a tiger clawing my face. So you just learn to adapt, and every time I used to have shooting head pains, and I said, oh, and nobody could, I was investigated for TIAs and everything like that, and they couldn't tell me what was going on. So every time it happened, I said, oh, I sure hope these are signs of healing. And then it was, and after a few years, and I said, oh, okay, this is signs of healing, and I welcome this healing wholeheartedly, and you learn to deal with the pain on a different level. Because it is all healing, it's all good. To test a vagus nerve testing, the doctor may check your gag reflex. Do you know how they would do that? Tongue depressor.
Yeah.
If you do not gag, this may be due to a problem with the vagus nerve. On the other hand, if you have a hypersensitive gag reflex, like some people can't even have a dentist working on them or put a toothbrush, or they have a really hard time, that could also be due to a problem with the vagus nerve. And it can be measured during electrocardiogram to measure the heart rate, other than the simple gag reflex test in your doctor's office. The heart rate variability. So they could determine from that something's going on with the vagus nerve. And so vagus nerve stimulation has been shown to improve such conditions as anxiety and mood disorders, migraines and tension headaches, tinnitus, memory disorders, alcohol addiction, bad blood circulation, heart disease, obesity and bulimia, allergic reactions, Alzheimer's, and even some cancers. And now to clarify here, I'm not talking about vagus nerve stimulator, VNS. That is actually a device similar to a pacemaker that is surgically inserted into your skin. And it is a device, a treatment option limited to select individuals with epileptic seizures, drug-resistant depressive disorders, and rheumatoid arthritis. This is not what we're going to be talking about. This is more natural nerve stimulation that you can do with yourself. Acute cold exposure, cold shower, splash cold water on your face, drink cold water. Humming, singing, or chanting increases the heart rate variability. Singing in unison or in choirs increases the HRV and vagus function. And singing also increases oxytocin, which is the love hormone, and it makes people feel closer to one another. Positive social relationships. When you think compassionately about others while silently repeating positive phrases, you increase positive emotions like serenity, joy, and hope. Results show a more toned vagus nerve than simply meditating. So even when you're doing this positive social relationships and there's meditations and thought processes you can do, they find this is even more effective than just meditating on its own. So we're coming up to our 20 minutes here. Does anybody need a break, or do we wish to continue going?
We're good?
So we continue on here, how you can stimulate the vagus nerve. Breathing exercises, breathing deeply and slowly. It lowers your blood pressure and it reduces anxiety. Meditation. Breathing-based meditation stimulates the vagus nerve and provides numerous autonomic effects, including changes in the heart rate, improved cognition, and improved bowel function. Loving-kindness meditation increases vagal tone, as well as guided meditation also increases vagal tone. Prayer enhances cardiovascular rhythms and feelings of connectedness. There's lots we could do on ourselves here. Yoga and Tai Chi, especially helpful for those who struggle with anxiety or depression. Laughter is a natural immune booster and feelings of connectedness with others. Massage your feet and your neck along the carotid sinus, and this is what Dr. Haxton showed us here, is that you can just rub alongside here, and that helps as well to stimulate the vagus nerve. Acupuncture, sleeping on your right side, chewing gum, gargling, tensing the stomach muscles, and exercise, which increases the brain's growth hormone. It helps and also helps reverse cognitive decline. And mild exercise stimulates gut flow, which is also mediated by the vagus nerve. Just an amazing little function in our body, this vagus nerve. So now we get to the gut-brain connection. Interaction between nutrition and the vagus nerve is well known, as we discussed earlier, is the gut-brain connection. Vagal tone can influence food intake and weight gain. Intestinal dysfunction leading to a myriad of negative health outcomes are caused by antibiotic use, poor dietary habits, environmental and food toxins, chronic stress. Funny how that one keeps coming up. And biotoxins. Biotoxins are substances which are both toxic and have biological origin. They come in many forms and can be produced by nearly every type of living organism. An example here, we have mycotoxins made by fungus, and that's why you don't eat certain mushrooms, I guess. And zootoxins made by animals. I guess that would be, I was trying to think of some examples, and I was thinking the H1N1 virus and that type of thing that we get from certain animals and birds. And phytotoxins are made by plants. And again, I was thinking like poison ivy and that type of stuff. But I don't know, this is the gut-brain connection, so I don't know what we would be eating that would have cytotoxins in it, or phytotoxins. The core of anxiety and depression can be found in the absence of metabolic safety. So if you have a lot of gut issues going on, and if you have a lot of side effects happening, that type of thing, if you have gas and bloating and cramps and pain and that type of thing, well, that's called metabolic safety. If you're not having that and you're dealing with the opposite of that, your whole system is insecure and you just can't relax because you're just having these symptoms all the time. So that's where anxiety and depression can be a result of that. So 20% of the vagus nerve fibers send instructions from the brain to the stomach. These signals control gastric acid secretion, digestive enzyme secretion, gastric capacity, and blood glucose. And then on the other hand, 80%, I was shocked at this number, of the vagus nerve fibers send instructions from the stomach to the brain. These signals control, I don't know how to say that word, hunger, satiation is fullness, and energy metabolism. So I thought it was always maybe equal, like 50-50, and I came across this and it says, no, it's 20-80. So that's why it's interesting when we have a brain injury, and if the brain signals aren't getting down to the abdomen properly, it's only 20%, but then I see that if the abdomen's not working properly, that's really affecting our brain right there, and that's where you get a lot of the brain fog and all that kind of stuff, and the fatigue. The gut-brain connection, brain injury, both concussions and TBIs, is another factor now known to damage the health of the gut, adding yet another layer of concern to an already serious health concern. It is vital to address intestinal and gut issues when treating brain injury as a way to prevent long-term health outcomes. Foster healing for the brain by reducing the inflammatory response that originates from the gut. So this way you can add probiotics to your diet. They either come in those little capsules and that, and if you buy a good quality one, you keep it in the refrigerator and you take this capsule once a day, I think it is. Add fermented foods to your diet like sauerkraut, sourdough bread, yogurt, tempeh, and kimchi. And eliminate or greatly reduce junk food, fried foods, sugars, artificial sweeteners, salt, saturated fats, and alcohol. What am I going to eat? So the best food to buy is always organic, and I follow the Environmental Working Group. I've been following them for about 20 years now on various matters, but they come up here with a list every year about the Dirty Dozen, and the Clean 15 list. So the Dirty Dozen, you can go online, the references is on your reference list there as well too, or you can just Google them. So in 2019, their Dirty Dozen here included strawberry, spinach, kale. Kale's been in the news a lot the last few days. Nectarines, apples, grapes, peaches, cherries, pears, tomatoes, celery, and potatoes. So if you want to eat any of those and you're concerned about the pesticides, residue, and that type of stuff, I would always buy organic on those 12 of the Dirty Dozen. Then they have the Clean 15, which we can access here, it's online. And then those, if you can't buy everything organic, who can? And then there's a Clean 15, so those are ones that you can access and just buy regular. You don't have to buy organics on those ones, but definitely on those top 12, start targeting those. Implement a low FODMAP foods in moderation on a short-term basis. Again, you would probably speak to your doctor about that. The acronym FODMAP stands for, anybody want to give that a go? So it addresses gut bacteria when you do eat low FODMAP foods, and it seems to be the most effective dietary intervention to help reduce chronic IBS symptoms. So just to give you an idea, here's some high FODMAPs that you should be avoiding if you're concerned about your intestinal health. So certain vegetables like garlic, onions, scallions, asparagus, beans, and soybeans, cauliflower, and cabbage. This is not an exhaustive list, there's a lot more.
Oh my God, I can eat nothing.
And there are references as well too in the handouts there. You can check out more on FODMAPs. And certain fruits is apples. Apples, I have a typo. Apples, apricots, avocados, blackberries, grapefruit, mangoes, peaches, and plums. So these are high FODMAPs which aggravate the intestinal lining.
How can they put avocados on that list?
Well, there's a low FODMAP one coming up here.
Oh, okay.
You have to understand the FODMAP meaning. So that's why I gave you references there, and you can go check it out. Yeah. Certain grains as well, barley, bran, couscous, rye, and spelt. Certain nuts, cashews, and pistachios. Certain cow, goat, soy, rice, buttermilk, and cream. And so here are the low FODMAPs to choose for intestinal health. Vegetables, bean sprouts, green beans, cucumbers, corn and popcorn, sweet peppers, squash, and potatoes. Again, this is not an exhaustive list, it's just to give you a few examples. Fruits, bananas, blueberries, cranberries, grapes, kiwi, citrus, pineapple, raspberries, and strawberries. Grains, oats, quinoa, buckwheat, and rice. Nuts and seeds, almonds, hazelnuts, macadamia, peanuts, Brazil nuts, walnuts, poppy, pumpkin, sunflower, sesame, and chia. And protein, tofu, tempeh, and chickpeas. So again, there are several references on the list there, so you can investigate that or speak to your doctor about it, see if they know about FODMAPs and best to advise you. I'm starting to see a lot of them now in the natural food stores, and I picked up a salsa. It was actually quite tasty, but the main thing is it didn't have onion and garlic in it. Oh, but it was really good. So the polyvagal theory, so this is healing trauma now, we're moving on for a different section here. Polyvagal theory helps unlock symptoms of PTSD. One of the most painful aspects of PTSD is experiencing a lack of control, which occurs when you have feelings of being trapped by certain emotions such as anxiety, panic, being overwhelmed, or despair. The vagus nerve connects the brain to major systems in the body, supporting mind-body communications. With the help of a qualified therapist, you can use tools to engage your nervous system to reestablish nervous system functions. Vagal tone can be consciously raised to generate more inner feelings of safety. Compassion meditations for gratitude and forgiveness. These are just some of the tools that a therapist will introduce you to. Trauma-informed mindfulness meditations. Conscious movement practices such as yoga or Tai Chi. Coherent breathing and other types of breathing practices that increases the heart rate variability. Metabolic informed body work such as biodynamic cranial sacral therapy and colon hydrotherapy. And on your own, polyvagal theory in action can allow you to increase your sense of freedom in body and mind whenever you begin to experience symptoms of anxiety, panic, or depression. Here's some things that you can be doing for yourself. Focus on the present moment. Don't be worried about the past, it's gone and done. Don't worry about the future, it hasn't got here yet, and half of that probably won't materialize anyways. Focus on the present moment, and that's part of mindfulness as well too. Engage the sense of smell with an essential oil that brings a positive association or feeling. Oh, half of my rehab was all essential oils. I don't know how I would have survived half of this without them. Reestablish connection by calling a friend or snuggling with your pet. Express feelings through talking, writing, drawing, or movement. Focus your breath to regulate the nervous system. Engage in a mindfulness practice such as meditation or therapeutic yoga. Allow yourself to play or get creative. Focus on the good by tuning into the beauty around you. And here's an interesting photo here. I actually took this in 2016. I was getting out of the parkade, and just as I was getting out of my car, and something caught my eye, and I looked over and I saw this, and it literally took my breath away. And I said, you should be prepared to see beauty everywhere, even in a lowly parkade. And it's just like, I stood there in awe, and this is the way the light was hitting the tree, and I go, oh, I have to take a picture of that. But that's a prime example. Like, when we live in urban areas, it's very disruptive, very, what's the word I'm looking for? It's not a very respectful environment to be in when you're dealing with brain injury and concussion, and especially with PTSD or any kind of trauma. You need to find beauty around you as much as you can. Sympathetic actions involving mobilization, the need to move your body to release, this is continuing stuff that you can do on your own, to move your body to release the buildup of stress, cortisols. You can also engage your nervous system by rubbing your hands together vigorously and making physical contact to your face, to your neck, to your upper chest, to your arms, and to your legs. You can also explore physical movements that feel safe and are grounding, like going for a walk, shaking your arms and legs to release stress. And I found too, if you can find it, I was on a rail tour in 2017. I found a nice big flat rock when we're out somewhere in the mountains looking at something, and everybody else was looking over here at the scenery, and I found this nice big flat rock, and I was laying there, and that's the ultimate of grounding that you can ever find, and I can't find any here in Calgary. So when I saw that one, and I said, I'm going for the rock.
That'll do.
Yeah, and I laid there in bliss for about 10 minutes. It was wonderful. When you can embrace immobilization with safety, you can access the nourishment of the relaxation response. And it takes time, it doesn't come automatically. So you have to be patient. To move through trauma, we need quietness, safety, and protection, similar to that offered in a bird in the gentle warmth of a child's hands. We need support from friends and relatives as well as from nature. With this support and connection, we can begin to trust and honor the natural process that will bring us completion and wholeness and eventually peace. I wish you well. So that's the end of our presentation. We'll now cover our resources and our links here. And there's a slew of them here. They're all in your printouts there. But just to give you an idea of some of the research I did to put this presentation together, and if you're looking for more information, you can check out all these articles, and all the links are on there. But they're hard to access on there, so just start Googling those titles and you'll find them. There's the ones on FOD maps there. There's 2 of them. And this is the Environmental Working Group, their Shopper's Guide to Pesticides. That's the other one we were talking about. And for further reading, for people who want more of a scientific understanding of the vagus nerve, these two books are available at Calgary Public Library. Stanley Rosenberg, Accessing the Healing Power of the Vagus Nerve, and Stephen Borges. And I came across him at one of those online summits on February 1 on the embodied brain. They had an online conference on yoga, neuroplasticity, and the new scientific paradigm. And that's when I came across him and his research, and I became all excited about the vagus nerve. But I've been hearing about it for a while, but after hearing him talk, and I said, I gotta know what's going on here. These are also other books that are really good for healing trauma and dealing with stress. Gabor Mate, he's a doctor from Vancouver actually, and he's a well-respected expert on addictions. And I love this book he wrote here, When the Body Says No, the Hidden Costs of Stress, the Cost of Hidden Stress. And again, this was, I forget when it was published, I think it was 2004, and it was before the vagus nerve was really coming up into the forefront. And all the therapists, the massage therapists, the chiropractors, functional neurology, cranial sacral, chiropractors, they're all really, they're zoning in on the vagus nerve and how it's affecting everybody and how it affects multiple organs, and this is the key into our healing. And Peter A. Levine, Waking the Tiger, Healing Trauma, and Peter Levine again, In an Unspoken Voice, How the Body Releases Trauma and Restores Goodness. Those are highly recommended for anybody dealing with trauma or PTSD. And now we move on to community resources. For anyone who's never been here to our meetings before, if you're new, these are some local services that are available. The Calgary Brain Injury Program over at the Foothills Hospital. You need a referral from your doctor to get in there, and it has to be within 3 months of your injury. And they also, when you go through their program, they also liaison with the CAR program as well too, and they can refer you to the CAR program, which is this one here. And if you don't, after 3 months, but before 18 months post-injury, again, a referral from your family doctor, and you can get into the CAR program. And they have 3 centers at Peter Lougheed, Sheldon Shamir, and the South Centre Health Campus. And it's a short-term active rehab program. They teach you the basics of what a concussion is, and you have access to some practitioners and therapists here. As well as local services continued here. Acute Sport Concussion Clinic, it's at the U of C. It has to be an injury that's sports related between ages 13 to 60 and occurred within the last 4 weeks. And if you fall into those categories, you can go to them for some help. And the children are involved, the Calgary Childhood Complex Concussion Clinic at the Alberta Children's Hospital, and they deal with cases for children up to 18 years old. And as well, My Health Alberta, they now have a early concussion education module for patients, and there's a link there, and it's also listed in our resources handouts there. And there are local grassroots support for concussion and concussion awareness. And the first one is our group here, and the other one is Concussion Life, and they have the website there. They meet the first Monday in Kensington. And Concussion Info and Support Meetup, they meet twice monthly at the Co-op Midtown Market, and they have a link there on the Meetup website. And we're on Facebook, and we meet the last Friday of each month. As well, too, when you come here to our meetings, you have access to informational handouts, and they'll always be at the back table there, so you can help yourself to those. And as well, too, our presentation videos are available on Facebook and on YouTube. And I highly suggest, again, if you're new here or thinking of coming to, or considering coming to our meetings, it's highly recommended that you do watch our first 2 videos. What is a concussion? The introductory presentation, so you get a good basics of what a concussion really is. And then you can start understanding the consequences of what happens when you have multiple concussions. So those 2 videos are very highly recommended, but as well as all the other videos, check the titles there. And we have a coping strategy series, part 1, 2, and 3 is very interesting and very helpful for a lot of people as well too. And they're all available for free online, so help yourself there. There's also online support groups for concussions on Facebook. There's a whole list of there. Of course, our group there listed, Calgary Concussion Awareness and Support. There's also Pink Concussions. It's down in the States. It's females over 25. They just started up now, Pink Concussions Canada. So So that's kind of nice to be connected with people who understand our healthcare system and our benefits and that type of thing. It's totally different down in the States. And of course, if you're dealing with traumatic brain injury, if you had a neuropsych assessment and you've been diagnosed as mild, moderate, or severe, these kind of groups would be very helpful for you. Mild traumatic brain injury awareness is highlighted in orange because that's a page that I run. And our upcoming meetings, we meet the last Friday of every month from September to May, but not December. Our next meeting is Friday, April the 26th, and we're going to be talking about coping with headaches. And these are some of the other topics we're considering on working and bringing in some guest speakers for next year when we start up in September. And so we do have flyers back there. Please help yourselves to those and pass them along to friends and family or co-workers that you think might be interested in learning more about concussions. Or if you prefer to receive the flyer electronically, we have a sign-up sheet there. You can put your email on there and I can send information to I'll let you know when the video's been posted and access to the flyers. And that concludes our presentation. If anybody has any comments or questions. As well, too, now we have open discussion and sharing. If anybody has no further questions, we can sit down and have a chat.
Sorry, I was late.
You were late.
I got lost.
I'm going to shut the camera off now because we don't record this part.